Hi, my name's Caitlin and I'm a level 1 nursing student. My clinical instructor has assigned me to observe you today.
Excellent. Feel free to ask me any questions you might have.
Thanks so much. I look forward to learning a lot. So, you're taking care of the patient room 231. Do you have time to give me a report?
Yes, I do. 231 is Dr. Engelbert's patient. She's a 34-year-old female admitted for a fever with an unknown cause. Right now, she has end-stage renal disease. She was placed on the transplant list about 6 months ago. She's also a type 1 diabetic since 8 years old. We're waiting for the cultures to come back to rule out bacteremia or a UTI associated with her fever. Her vitals were, everything was in defined parameters besides the fever. At 0645 it was 100.9, shot up to 101.1 at 730. She's a full code. She's allergic to Bactrim. She gets a rash whenever she takes it. She's also on dialysis 3 times a week for her renal disease. She does perform all ADLs perfectly. She's on a renal diet, 1500 fluid restriction. She's a learn-oriented ×4. She's cooperative, speaks clearly. She does have some numbness in her left and right legs. Breath sounds are clear. There is a little productive cough though, with clear and scant sputum, but her breathing's unlabored. Everything else is fine there. Cardiovascular wise, she's on tele with sinus tachy right now. You can hear, there's a bruit and thrill present. She has non-pitting edema in her lower legs. On her hands, the cap refill was less than 3, but on her legs, it was greater than 3. So that's something to look out for. She also has some dorsalis pedis weakness. It's +1. Her left and right radial pulses were +2 though, so that's fine there. She's continent. Her stomach was flat, non-tender. Her last bowel movement was on Sunday. She has normoactive quadrants, all 4 quadrants. She did put on about 10 pounds in the past few weeks, so we're trying to monitor her input and outtake. Her urine was an amber, cloudy color. She had some difficulty urinating, so we're going to try and collect a urine sample. We did set up everything on the bedside and explained what it's for and why. She turns herself. Her skin, though, she was a little flushed, but she does have good elasticity, full range of motion. She does have a little weakness standing. Her pain was rated out of 4. She said it's like an aching pain associated with the fever. Her glucose when she was first admitted at 0:45 was 210. An hour later it was 167, and the next hour is 155, so it's slowly getting itself down. She has an 18 gauge IV in the right forearm. Right now the plan is just to get that urine sample, get her on her normal dialysis, and then start the IV antibiotics. She does have her imipenem and cilastatin with sodium chloride due soon.
Thank you so much for giving me a report. Do you mind if I ask you a couple of questions regarding the med administration and then watch you demonstrate giving it in the patient's room?
No problem at all. What questions do you have?
Why specifically is this client receiving this medication, and what action does it have on the body?
Well, Mrs. O'Connor is receiving the medication because she has a suspected infection such as bacteremia or UTI. We're waiting on the cultures to come back right now to confirm anything, so just as a prophylactic measure, she's getting the antibiotics. This drug is a bactericidal drug. It binds to the cell wall, causing cell death, thus, killing the infection.
Okay, and when should you question administering this medication?
You should definitely question administering the medication if the client has any hypersensitivity to or reaction to penicillin or cephalosporins, if they have any seizure disorders, renal impairment or pregnancy, and pregnancy because it hasn't really been proven safe yet for breastfeeding.
Okay, and does this medication have a therapeutic serum level?
It does not have a serum level.
Which vital signs must be monitored?
You want to watch out for all vital signs, paying special attention to O2, temperature, heart rate, look out for any drastic changes related to anaphylaxis and compare the vitals to the baseline.
Okay, and which physiological parameters should be monitored when the medication is being administered?
Well, mainly you want to assess for any type of infection. You want to obtain all specimens for culture and sensitivity before initiating the therapy. But the first dose can be given before receiving the results. And throughout the therapy, you want to assess, the wounds for infection, the sputum, the urine, the stool, and of course the white blood cell count. That helps to.
Okay. And what interventions must be taught to the client to ensure medication is administered safely both in the hospital setting and at home?
Well, in the hospital setting, it's important to determine any reactions to penicillins or cephalosporins. You want to check the medical record as well as asking the patient, and you want to teach them to disclose all allergies. Because sometimes people with a negative history or sensitivity can still have an allergic response, and it's very important to teach them the signs and symptoms of anaphylaxis so they can tell you. At home, you want to teach them the signs of superinfections such as like black furry overgrowth on the tongue, vaginal itching or discharge, and loose or foul-smelling stools. And you also want to teach them when to notify the healthcare advisor, such as if fever and diarrhea occur, or if you have blood, pus, or mucus in your stool. That's very important. And also, everything you teach them, you want to document it. And be sure you use the teach back to me method so you understand that they're understanding what you're teaching them.
Okay, and what are the side effects and potential adverse reactions?
The main side effects are diarrhea, nausea, vomiting, and a rash. The most concerning adverse reaction is anaphylaxis, pseudomembranous colitis, and seizures. That's why it's contraindicated with people that have seizure disorders. And you'd also want to document all of these as well.
How will you know this medication is effective?
The client's lab work will most likely show a decrease in the white blood cell. Hey, how are you doing today?
I'm good. How are you?
Very well, thank you. I'm Kaylee. I'm going to be your nurse today. Is it okay if I have a student with me?
Absolutely.
Okay, perfect. Alrighty. So I'm here. You have an order to get imipenem cilastatin. Do you know why you're getting that medication?
I don't.
Well, it's an antibiotic. The doctor is suspecting either a UTI or bacteremia, so he wants to do a prophylactic treatment to try and stop the infection. So it's an antibacterial med, and it works to break down the cell wall of the bacteria.
Okay.
And then the cilastatin is just to help prevent the renal system from breaking down the medication too quickly.
Okay.
So the first thing I want to do, can I have your name and date of birth, please?
Shanae O'Connor, 52880.
Okay, so I'm going to ask the patient her name. I'm going to check her armband, and then I'm also going to compare it to the EMAR. So I see Shanae O'Connor, birth date, perfect. All right, so we're looking at the EMAR right now. As you can see, she is scheduled her imipenem cilastatin IV at 8 o'clock. Right now it's 7:30, so it's perfect timing. We can see it's 500 milligrams IV piggyback every 8 hours. And then it goes along with the sodium chloride, which is continuous at 30 milliliters an hour. Okay, so this is going to be hanging piggyback with the sodium chloride. So what we're going to do now, do you have any allergies?
I'm allergic to Bactrim, and I think maybe sulfas.
Okay. So you always want to ask the client what their allergies are, as well as check the EMAR and double check, because you never know what allergies they might have not documented or was documented incorrectly. Okay, so now I've already pulled the 2 drugs. We have the sodium chloride and the imipenem cilastatin. So the first thing you want to do is check the expiration date. So it says January 2016 and January 2016. So both of these are fine. Now I'm going to be hanging this one first. So first thing we're going to do is unplug. Oop. First thing we're going to do is take the tubing out. Have that ready. Here. So then we're going to take this out, and once this is out, everything in here is sterile, so you want to be careful not to decontaminate it, as well as with this. Once we take this off, it is sterile, so you just go sterile to sterile, and real quick. Want to make sure it is clamped. Hang this up here. Take out this, and then the stretchy rubber part will go in here. There we go. And then take this off. And then we're just going to hang this up for now. This is sterile because it has the cap on it, but we're still want to put it up here just in case until we get the piggyback up there. So now we're going to go back over here and we're going to unplug this one. And then same here, take the cap off, and it is sterile. Just gonna put that in there. Make sure this one is also closed. And then this one is actually gonna go above this. But before we connect anything, we have to prime the line. And then the sodium chloride goes below the imipenem cilastatin, so that this will flow first and then default to this. Okay, so that works out good. So now we're going to prime the sodium line. So you can see it's slowly working its way through. Takes a little patience, just make sure get all the air out. Perfect. So now we're going to clamp. And now is the right time to put it into the pump. Close the door. Now for the imipenem cilastatin, that is actually much easier to prime. Before you connect it though, you always want to scrub the hub for about 15 seconds. Take the cap off. connect. And then to prime this, we'll just lower it. As you lower it, the air will move its way up the line, priming it for you. So now it's completely clear. Alrighty. So I pulled up the Carbapenems statin on the screen, and I have to verify the client's name and date of birth. Can I have your name and date of birth, please?
Shanae O'Connor, 52880.
Okay. So I have scanned it, and the information is in there. Now I'm just going to scan the medication. As you can see, it has turned green, verifying all the information is correct. I have the right medication with the right patient at the right time. So everything's good. Now you always want to double check. Check your rights. So you have the right medication, you have the right client, the right dose, the right route. Okay, and everything looks good at the right time. Perfect. So it'll be 7:30. I'm not going to submit anything yet until it's actually running. So now we'll move over here and start setting the pump. So no, it is not a new patient. Yes, they're on medical surge. And we're going to be selecting channel A. It'll be normal fluids because we're doing the saline first. 0%. Oops. Start over. IV fluids, 0.9%. Yes, this is correct. The rate is 30 milliliters an hour, and the volume to be infused is 500. And now the secondary, which we have already scanned, is the imipenem and then it is 500 milligrams per 100 milliliters, so that is correct. Yes, this is correct. And then you just want to double check everything. Yep, that is correct. And then the duration is over 1 hour, so we'll put 60 minutes. And then we're not going to start yet. Now, just like we scrubbed the hub on the line, you also want to scrub the patient's IV hub as well for about 15 seconds. The pump may beep, but it doesn't mean anything's wrong. It's meaning that it's just not running yet. So now we'll take our sterile IV, take the cap off. And we'll start running. So we'll start first by checking the line, making sure there's no air in it. Okay, so now that it's running, I can do my documentation. So documentation is administered in the right forearm IV. Oops. The dose was 500 milligrams. 100 milligrams an hour. Patient tolerated the procedure well. Then you put your initials. And then we're just going to scan the normal saline. How this documentation is set up, we just have to verify one more time. Can I have your name and date of birth again?
Shanae O'Connor, 52880.
Okay, now we just scan the meds. the right form. Time was 7:30. Given 30 milliliters an hour, and the patient tolerated procedure well. Okay. Shanae, how are you doing over there? Are you feeling a headache or any dizziness, discomfort, anything changing?
I'm just sleepy.
Okay, perfect. That's no problem. I've actually printed you some educational information about the medication you're taking, your suspected diagnosis, and then the risk factors that go along with it. So I'll let you review that for a little bit, and then I'll be back in about 30 minutes to just discuss everything and then maybe answer any questions you have, okay?
Okay, thank you.
All right, you're welcome.
Thank you so much for demonstrating a safe medication administration. I just have a couple more questions for you if you don't mind.
Sure.
Were there any pertinent pieces of information you reviewed before administering a client the medication?
Well, first I reviewed the client's history and admission data to assess for allergies, as well as asking the patient themselves if they have allergies. I also checked to make sure the medication didn't interact with any other medications or existing health conditions. I also reviewed the expiration date on the medication and compared it to the EMR and the doctor's orders for the amount, the time, the dose, all of the rights.
Okay, and did this information affect your decision to administer the medication?
Yeah, if the order had not matched or I noticed some kind of potential threat or adverse reaction complication that could arise, I would have questioned giving the medication and contacted the doctor. You want to trust your gut feeling.
Did this information affect how you administered the medication?
Yes, this drug can also be given in an intramuscular injection, but the route is never flexible, so you want to follow what the doctor says unless you see some concern as why it shouldn't be administered that way.
Thank you so much for answering all of my questions. I really feel like I understand this so much better.
Again, not a problem at all. I'm always here if you have any questions or need anything. I'm going to take some time now and document the teaching I provided to the patient, as well as any other things I did in the patient's room. Do you want to observe me documenting as well?
Sure, I'd love to watch. Thank you.
You're welcome.